Is bedwetting normal? If your older child still wets the bed, you're probably wondering if it's normal, why it's happening, and what you can do to help. In this video, I'll explain why bedwetting happens, what you can do at home, when it's time to speak to your GP, what treatments are available, and how to support your child's confidence. Bedwetting, nocturnal enuresis, is much more common than many people realise. Around 1 in 10 children aged 7 still wet the bed. By the age of 10, around 1 in 20 children are affected. For most children, bedwetting becomes less common as they get older, although some teenagers are still affected. So if your child is still wetting the bed, they're far from the only one. It doesn't automatically mean there's something wrong, and it certainly doesn't mean they're doing it on purpose. Why does bedwetting happen? Bedwetting, nocturnal enuresis, doesn't have one single cause. In many children, it's a combination of factors. For some children, their brains don't respond strongly enough to signal that their bladder is full, so they don't wake up in time to use the toilet. For others, they produce more urine overnight than their bladder can comfortably hold. This can happen if they don't produce enough of a hormone called vasopressin, which normally tells the kidneys to produce less urine while we sleep. Some children also have a bladder that's smaller, more active, or still developing, meaning it fills more quickly overnight. Constipation can also contribute because a full bowel can press against the bladder, reducing the amount of urine the bladder can comfortably hold. Genetics play a role too. If one or both parents wet the bed as children, their child is more likely to experience bedwetting as well. None of these causes is something your child is choosing or can simply control. What if my child was dry and has started wetting the bed again? One of the first questions a healthcare professional will ask is whether your child has always wet the bed or whether it started after a period of being dry. Some children have never been consistently dry at night. This is called primary bedwetting, primary nocturnal enuresis. Other children are completely dry for at least 6 months or even years and then suddenly start wetting the bed again. This is called secondary bedwetting, secondary nocturnal enuresis. There are several possible reasons why this can happen. Sometimes it's linked to constipation, a urinary tract infection, diabetes, or another medical condition. Sometimes it happens during periods of stress or major life changes such as family separation, moving house, changing schools, or other significant events. That doesn't mean every child who starts wetting the bed again is experiencing emotional difficulties, and it doesn't mean every episode is caused by stress. The important thing is not to jump to conclusions. If your child suddenly starts wetting the bed again after being dry for at least 6 months, it's worth arranging an appointment with your GP so they can look at the whole picture and decide whether any investigations or treatment are needed. What can parents do during the day? If your child has bedwetting, nocturnal enuresis, there are some simple things you can do during the day that may help. Encourage them to drink regularly throughout the day, rather than drinking very little and then trying to catch up in the evening. Try to avoid large drinks in the hour or two before bedtime, but don't deliberately make your child thirsty. It's also best to avoid drinks containing caffeine, such as cola, tea, coffee, and energy drinks, because these can increase the amount of urine the body produces. Encourage your child to use the toilet regularly during the day and always before they go to bed. If your child is constipated, it's important to get that treated because constipation can reduce the amount of urine the bladder can comfortably hold and make bedwetting more likely. These simple routines won't stop bedwetting for every child, but they're an important place to start and are often recommended before moving on to other treatments. How can you make nights easier? If your child has bedwetting, nocturnal enuresis, a few practical changes can make nights much less stressful. If your child wets the bed during the night, try to keep everything as calm and low-key as possible. Use dim lighting where you can, have clean pajamas and bedding ready, and help your child get settled back to sleep as calmly and efficiently as possible. Breathable waterproof mattress protectors can make changing the bed much easier, and layer in the bed with a waterproof protector, a fitted sheet, another waterproof protector, and another fitted sheet can save valuable time during the night. Some families also use reusable absorbent bed pads. These can be helpful, but they may move out of position if your child wiggles a lot during the night, so they don't suit every child. Some families choose to use pull-ups or absorbent underwear. Although they're not a treatment for bedwetting, they can be a practical way of managing its effects while you work with your healthcare professional to find the most appropriate treatment for your child. Current NICE guidance suggests considering a trial without pull-ups in children who are already dry during the day, because the long-term aim is to help children recognise bladder signals and wake naturally. The best approach will depend on your child's individual needs and the treatment they're receiving. The goal isn't just to protect the mattress, it's to find an approach that supports your child's treatment while keeping nighttime changes as calm and manageable as possible. Should you reward, punish, or wake your child? If your child has bedwetting, nocturnal enuresis, it's understandable to want to encourage dry nights, but it's important to reward what they can control, not what they can't. Use positive rewards for things your child can control, such as following their bedtime routine, using the toilet before bed, following the drinking routine you've been advised to use, helping with treatment if they're old enough, or responding to a bedwetting alarm if they're using one. Remember, this doesn't mean restricting drinks. Children should still drink enough throughout the day. The goal is to follow a healthy drinking routine, not to make your child thirsty. Don't reward dry nights because bedwetting isn't something children can simply choose to stop. Never punish, blame, or shame your child for wetting the bed, and avoid reward systems that take away rewards they've already earned. Bedwetting isn't something a child chooses to do. Many parents have also been told to wake their child during the night to use the toilet. Years ago, this was common advice, and it can sometimes keep the bed dry for that night. However, it's no longer routinely recommended as a long-term treatment because it doesn't usually help children learn to wake when their bladder is full. Instead, current treatments focus on helping children either produce less urine overnight or recognise the signals from a full bladder so they can wake naturally. When should you speak to your GP? The NHS considers bedwetting to be common in children under the age of 5, so it isn't usually a cause for concern. If your child is aged 5 or over, you've tried the things you can do at home and they keep wetting the bed, it's a good idea to speak to your GP. You should also speak to your GP if your child starts wetting the bed again after being dry for at least 6 months. You should also seek medical advice if they have daytime wetting, pain when passing urine, a weak or unusual urine stream, excessive thirst, constipation that isn't improving, or if you're worried there could be an underlying medical condition. Your GP can assess what's happening, rule out possible medical causes, and discuss whether any treatment might help. What help can the NHS offer? If your child has bedwetting, nocturnal enuresis, your GP will usually start by asking about your child's general health, drinking habits, toileting, constipation, and whether they're having any daytime symptoms. If needed, they may ask for a urine sample to help rule out possible medical causes, such as a urinary tract infection or diabetes. One of the most effective treatments for ongoing bedwetting is a bedwetting alarm. The alarm detects the first drops of urine and sounds or vibrates to help your child wake up. Over time, this helps train the brain to respond to the feeling of a full bladder before bedwetting happens. Bedwetting alarms don't work overnight. They usually take several weeks of consistent use, so it's important not to give up too early. Some children may also be offered a medication called desmopressin. Desmopressin reduces the amount of urine the body produces overnight. It can be particularly helpful for occasions such as sleepovers, school trips, or holidays, or even when a bedwetting alarm isn't suitable. Your GP or Children's Continence Service will help you decide which treatment or combination of treatments is most appropriate for your child. Protecting your child's confidence. If your child has bedwetting, nocturnal enuresis, remember that the emotional impact can be as important as the practical side. Many children worry that someone will find out. They may avoid sleepovers, feel anxious about school residential trips, or worry that their friends will discover their secret. If your child is staying away from home, planning ahead can make everyone feel more confident. That might mean speaking discreetly to the adult who's responsible for your child, packing any medication or supplies they may need, and agreeing on a plan with your child beforehand so they know what to expect. If your child is going on a school residential trip or spending time in someone else's care, make sure the adults involved know exactly what support your child needs. In my experience as a teacher, I also found it helpful when parents wrote down important information. It gives everyone a clear reference point so they know exactly how you'd like your child's bedwetting to be managed. If you only remember 3 things from this video, let them be these. First, Bedwetting is common. Second, it isn't your child's fault. Third, effective help is available. You don't have to just wait and hope your child grows out of it. With the right support, many children become dry.